Cancer is a scary diagnosis, and it's our #2 leading cause of death after heart disease. So I want to share with you some good news about cancer, and as regards lifestyle changes you can make right now as prevention, even if you've been diagnosed with cancer, things that you can do that maybe you haven't heard about that are pretty easy to do and highly effective. So I think you'll really learn some things today. As far as the stats are concerned, 2 million Americans are diagnosed with cancer every year, and 40% of those diagnoses are considered preventable by the things I'm going to be talking to you about today. 40%, that's almost half. So that's incredibly exciting, I think. So as far as changes in behavior, what's the #1 thing you can do is stop smoking. Now, most Americans, I guess it's estimated to 80 to 85%, have done just that. So our incidence of smoking in this country is at 15 to 20%. So that's drastically gone down over the years. So well done on that. So if you're somebody who's already quit, awesome. And if you've never started, don't. But if you are still smoking, the #1 thing you can do for yourself is to stop. Second on the list is obesity. Unfortunately, unlike smoking, that continues to rise. So we're on an upward trajectory for obesity, and there's a lot we can talk about and many things I have discussed, but I more just want to go over the fact that that's #2. Now, #3 is alcohol, and this is information that even though studies starting in the 1980s were reflecting this, it's really just been coming out the last few years as far as this dose-dependent response with alcohol ingestion and your risk for cancer. So even 1 drink a day is increasing your risk. So there's considered to be no safe dose of alcohol consumption. And the cancers that we know to be most linked to alcohol consumption, I'm gonna look at my notes here, are breast cancer, throat, colorectal, esophagus, liver, and mouth. So those are the ones that we currently know are most at risk with alcohol ingestion. So those are the things you can do. You can lose weight, you can stop smoking, and you can stop drinking. So these are, at least with the smoking and the drinking, just things to stop doing that make a huge difference. Now, exercise reduces your risk of several cancers. So now we have some of the most common cancers like colon cancer, breast cancer, endometrial cancer, stomach and esophageal cancer, and more. So there are several cancers associated with decreasing if you exercise. So as a prevention, so if you have not been diagnosed with cancer and as a prevention, you want to exercise anywhere from 150 to 300 minutes per week. So obviously 300 minutes would be 5 hours. And also, and this is considered moderate exercise. And so if you do vigorous exercise, like you're doing HIIT training, you're on a run, you can actually cut, to get a 2-for-1. So you can cut 150 minutes down to 75 minutes of high intensity. So you can sort of measure that out as far as how many minutes you're doing of high intensity. And let's see what else I wanted to say. So the really cool thing was that they found studies that even if you were overweight or are overweight, exercise is still giving you that benefit for reducing your risk. So that's exciting. Instead of just saying, oh, why bother? I'm obese and I just can't lose weight no matter what I do, so I might as well not exercise either. Don't say that, because it's absolutely been shown that exercise benefits you even if you're overweight. So that's good. Now, what does it do? So there's a couple of mechanisms here I think are really fascinating. So exercise is driving glucose, blood sugar, into your muscles because you're using your muscles. So what that does is it makes circulating glucose less available to cancer cells. So I thought that was fascinating because we know that glucose is the main driver of how cancer cells survive. They love sugar, they love refined carbohydrates, which is why those foods are terrible for you. But of course, we have glucose in our blood from metabolizing many different types of food, but the exercise is just shunting it away from the can. It's like, no, you can't have this, you can't eat this, I'm going to use it in my muscles. So I thought that was pretty fascinating. And that as far as prevention, there is a dose response up to the 300 minutes. So they basically found more exercise better, higher intensity better, up to the 300 minutes, and then the benefit kind of plateaued after that. So there was another study of, again, this is you're in the prevention mode, that being a weekend warrior, so like you don't do much of anything during the week, but then you really go for it on the weekend, that's okay if you're in the prevention mode. So you can just kind of shove it all into the weekend, and you're just doing a lot of activity, and you get the benefit for that too. You don't have to stretch it out. Now, what else did I want to go over with you? Oh, this was the other really cool mechanism. So if you're exercising, now this is when you have cancer. Now, of course, you can have cancer and not know it. You can be in very early stages. But what a tumor can do is it can shed what's called circulating tumor cells. So these are the things that allow metastasis to occur, because these shedding tumor cells are in your circulation and they're trying to find a new home. So what the research shows is when you're exercising, you're increasing the shear stress on these cells, because your blood is really moving intensely, and that shear stress can actually kill off these tumor circulating cells, and so they're less likely to survive just due to this increased shear stress on your blood. Isn't that fascinating? So that's why, if you've been still for prevention, but especially if somebody's newly diagnosed with cancer, then that recommendation for the weekend warrior, that goes out the window. Now they're saying, no, as many days as possible, you wanna try to exercise to have this kind of shear stress on your blood and prevent metastasis. And again, the more intense the exercise, the better your response even to cancer treatment like chemo and radiation. So I thought that was really fascinating. I love these mechanisms. I love the fact that you can exercise and just steal glucose away from cancer cells and just go, no, I'm using it to exercise. You can't eat this and get stronger, because I'm gonna make my muscles stronger. So let's see. I think that was all the areas I wanted to discuss with you. There's some more. Oh, I wanted to talk to you about the researcher. So his name is Kerry, with a K, Kerry Kernea, and he's a PhD out of Canada, and he's done all this research, and he's actually changing what the cancer associations are recommending for patients, because they used to recommend, if you were undergoing treatment, to just rest, and now they're finding, no, they really want the patients to exercise as much as they can, because sometimes there's a lot of side effects, and of course that's appreciated. But and then even if you're moving into a cancer diagnosis, if you're somebody who's been exercising, you have a better outcome. So really a lot of good news, I think, associated with this that I certainly didn't know, and makes you want to get out there and move, which we know has so many benefits for boosting your immune system and boosting your metabolism. So exercise is so beneficial across so many systems of your body, but now we know it can really help with cancer prevention and treatment. So I hope you enjoyed this. If you want to hear more on this topic, I have more research I want to do, and I'm kind of fascinated by it, but let me know if this is an interest level of yours, and we'll talk soon.